Hey, Eric Abelos here, and on today's COVID-19 update, I have Dr. Brian Harrington. Doctor, how are you doing?
Hello, I'm fine, Eric.
Great, good to see you again. What's going on with the cases here in Steamboat and Route
Yeah,
County, actually?
and people can go to the Route County website to actually see the data directly. But in essence, over the last couple of weeks, we may have plateaued to some degree with our case counts, meaning we're still seeing over 100 cases a week, but it might appear that we've not increased that rate. Now, our data from last week, of course, is still not completely mature. We still have some results trickling in, so that may change a little bit. But it does seem that we've had a kind of a pause in this rapid rise of cases that we've been experiencing the past month. We are now coming into the post Thanksgiving period, and we expect that there will be an impact from that, just like we've seen with every other holiday. I mean, we already have stories of cases of people being infected at group gatherings over the holidays, and I'm sure we're going to see more consequences from that. So I think we should not be surprised if in the weeks ahead we again see this rising number of weekly cases. We continue to have hospitalizations at our hospital. In the last, I believe, 7 weeks, we've had 8 documented deaths attributed to COVID-19, and we've only attributed 16 deaths throughout the year to COVID-19. So just in the past 7 weeks, we've had half our county deaths. Also noteworthy is in those deaths, 3 of those individuals, they're not members of any long-term care facility. While it's true that a majority of the deaths in our county, as it has been in many places in the U.S., has been in residential long-term care facilities, because of the rising prevalence of disease in our county now and how much more it's being spread amongst the community, it's been inevitable that we would eventually see residents of the county succumb to this infection as well. So we now have 3 deaths attributed to COVID-19 in individuals who are not residents of a long-term care facility.
We recently added a purple zone for that dial, and we're in the red. What is it going to take for us to go into the purple zone on that dial?
The metrics do have a number of parameters that partly guide things, but I think there's been I guess I'd say an evolution of focus on kind of the line in the sand, so to speak. And I know now that a lot of the focus is just on hospital capacity, ICU capacity, ventilator capacity. Do we have the staff? We currently, locally at our local hospital, have not breached that capacity, nor has our hospital system in the state of Colorado breached that capacity. It is having impacts. Certainly, I now know stories amongst my physician colleagues of having difficulty getting patients down to the front range for special procedures, sometimes even transfers, because those facilities are full, and they're full of COVID patients, and so they're pushing back a bit now on non-emergent things. But our capacity has not been breached yet, but that's where the state has a pretty fixed attention to, because I think that's kind of that last line in the sand. If we fill up hospitals and are over capacity at that point, I suspect they would make another move.
So you said that you've had some colleagues trying to ship patients down to Denver. Is that for on non-COVID related issues? I
Correct.
know you can't. Okay.
Correct.
Okay. I
Yeah,
was just
it's
wondering if it was
so
like a.
somebody might need a special procedure that we can't do here, and they can only do it at a particular specialty clinic down there that we don't have locally. So the patient has to go down there. Those are in some cases getting tough because some of those procedures need to be done in hospitals, and hospitals now, because they're getting full, are deferring a lot of these non-emergent procedures. Similarly, I think we are having some conversations here. We have patients all the time that we debate, should they stay, should they go down? And often we send people down there and nothing different is done and they're fine. And we just did have an abundance of caution. I think we are and will see further discussions in some individual cases where there's a little more of a detailed discussion of, does this person really need or benefit from being transferred down to the front range? Because that conversation is in the context of talking to the facility that feels that their beds are full.
There is a silver lining, though. These vaccines are coming out. When will we see these vaccines here in Steamboat Springs or Route County?
I expect, as of today, I expect that next week that we will have some vaccine on the ground here in Routt County. If things go according to what have been indicated to us. So today, actually, we're the 10th. This is December 10th. The FDA is meeting today to discuss the Pfizer vaccine and to review all the data, or to kind of wrap up their review of things. And so today, tomorrow, they may give an announcement saying that they've given an emergency authorization for use of the Pfizer vaccine. At that point, the vaccine is then referred to the Advisory Committee on Immunization Practices, a separate independent body. That body, by early next week, will give out their own recommendations of how to use the vaccine in terms of which patients are eligible to get it. They'll give some guidelines. Do we have to watch people for how long and things like that. When the emergency use authorization is given, I do believe that the vaccine will start flying out to the states, and so it will then become positioned so that once the Advisory Committee on Immunization Practices gives their further information, it will then be disseminated to the local health authorities and hospitals to start being given out. So sometime next week, I would expect that we have some vaccine here in Routt County.
And that is the silver lining. Dr. Harrington, thank you so much for joining me this morning. And thank you again for joining me. You do this every week, and I really appreciate it.
Yeah. And I would add I should have added one other point with the vaccine commentary, just that it's going to be more of a slow trickle than a fast rush. We don't expect very large numbers next week. And I think that what we hopefully will see is every week we'll see kind of some small amount coming in, and we'll use it as we get it. We will see other vaccines getting authorized, such as the Moderna vaccine in a few weeks, and that will add to the volume of what we can do. And we have a scheme that's been laid out by the state and the CDC in terms of how we prioritize who to give that to. And so initially, our focus will be on immunizing frontline hospital and inpatient workers who have a lot of contact with COVID patients. We'll also be focused on immunizing members of our long-term care facilities due to their vulnerable status. We'll move from that into other healthcare related workers, first responders. So we'll kind of get through that group, which I predict could, depending on the supply of vaccine, could take a month or two. After that, then we move into a second phase that focuses on vulnerable people in the population based on age or health conditions. So I'm hopeful that that second phase can begin by February. It depends a little bit on the supply of vaccine. And then sometime as we get into May, June timeframe, I hope by then that the vaccine is then being offered to anybody who wants it. That would include younger and healthier people.
So that's still 6 months out, really, is
yes,
kind of like a good goal.
Yes. And in terms of, the benefit of the vaccine is to save lives, to reduce the transmission of disease and protect our communities. We're probably not going to see that impact, though, for a month or two at least, because as we kind of slowly ramp up, you have to get to a certain level of immunization within the population to start to really see the impact of the spread of the disease.
Excellent. Well,
it's coming. There's light at the end of the tunnel here.
There really, really is. Well, thank you again so much. I really do appreciate you being on here.
Right. Have a good week, Eric. Bye.
You too. So, if you guys want a vaccine, you'll have to hang tight. If you want to stop the spread before the vaccine comes out, you'll also have to hang tight. Stay in your homes, hang out, Skype, Zoom, and watch more TV.